We're now joined by Deborah Visconi, who's President and Chief Executive Officer of Bergen Newbridge Medical Center. Deb, good to have you with us.
Great to be here. Thank you for having me.
You got it. We're going to put up the website of Newbridge. Tell everyone what it is and the work that you do, you and your colleagues do every day.
So, Bergen Newbridge Medical Center, the largest hospital in the state of New Jersey. We are publicly owned and privately managed. We are a safety net facility serving the residents and communities of northern New Jersey. We are 1,070 beds under a 1 million square foot roof, sitting on 62 acres of Bergen County property in Paramus, New Jersey. We have several distinctive service lines that set us apart from many of the hospitals and health systems in the area. Most notably, we have a very large and prominent behavioral health and mental health service line. We have a very large and growing and thriving substance use disorder service line. We have a long-term care division, so we are able to take care of the aging community in our county. And we have a very large and robust community health network, as well as an ambulatory care enterprise that reaches throughout the county of Bergen and beyond.
Yeah, let me ask you this, and also want to note that Deb Visconi was identified as number 2 on the 2004 NJ Biz Healthcare Power List. So congratulations on that, Deb.
Thank you very much. Thank you. It's really a testament to the work of the team here at Bergen Newbridge. So thank you for that.
Absolutely. I often say in our leadership programming that all the credit when someone at the top of an organization, when that credit gets pushed down, the blame and responsibility, Deb, always goes up. Is that true?
The credit, but it's really
the blame part we have to take as leaders.
The blame, yes, the blame. The credit goes to the team.
Always, always. Deb, let me ask you this. I'm curious about your journey to this position, to be the CEO of this very significant healthcare organization in these incredibly challenging times in hospital and healthcare, in the hospital and healthcare profession. Your journey, describe it, how you got to this position.
Well, I started my career in healthcare as a phlebotomist. So I was
Is
born
that blood?
Yes, that's the people who draw blood, the early morning people that come to your room in the hospital.
That's you.
That was me. But I was born and raised in Brooklyn, New York. I come from an underserved family. And one of the things that I saw firsthand growing up was the lack of access to quality health care in my community, and in particular for our family. And so I always had it in me to try to change the world to make sure that everyone had equitable access to quality health care, that no one should suffer, be ill, or die from not being able to get equitable access to care. And so that's always was part of who I was growing up. And so living in Brooklyn, growing up in that area of Brooklyn, New York, and then moving to Queens eventually, wanted to get into healthcare. My mother wanted me to be a nurse. I chose a different path. I chose medical laboratory science. So I am a lab tech by clinical background. Started as a phlebotomist, grew into the lab tech world, got on the bench, worked in a number of New York City hospitals as a bench tech in microbiology. Knew that I wanted to continue to progress my career so that I can get to a point where I can make the most difference to the communities that I serve, and went ahead and got my master's degree in health administration, and was armed in 1992 to take over the world with my new degree, and just grew my career through administrative ranks, serving hospitals in the New York region primarily, eventually moving into the New Jersey market, focusing on service lines and growth and community access to populations around the hospitals that I worked in. And eventually, I live in Bergen County, New Jersey. I've been here for 29 years, raised my family here. Eventually, this opportunity presented itself to be the leader, the president and CEO of the county-owned hospital. And, I looked at it, and it was presented as a transformational opportunity to take.
What does that mean? What does that mean, a transformational opportunity?
So it had a bit of a sordid reputation. It wasn't very well regarded.
There were real challenges.
There was quite a few challenges here, yes. And so the transformation was about making this into a destination hospital in the state of New Jersey and transforming this county asset into the asset that it deserved to be and that the communities deserved. And so it used to be run by for-profit, now, we went from for-profit to not-for-profit, and went into creating an asset for everyone in our county and in the northern region of the state, for anyone who needs access to care, anyone who needs access to quality care. We are partners with a clinical affiliate of Rutgers, New Jersey Medical School. We work very closely with some community partners, Care Plus New Jersey and Integrity House, in delivering on that mission to be a destination hospital in the state of New Jersey.
Deb, let me ask you, it's so interesting, your journey and also the history of Newbridge before it was named Newbridge and before this transformational opportunity / challenge came up. But I'm curious about this. Because you've been in the healthcare and the hospital world for a couple of years, what would you say the most significant long-term impact of COVID was and is on the world of health and healthcare and hospitals?
I would say undeniably, it's the recognition that health disparities and unequal access to care was something that had always existed, but it was exacerbated by the pandemic. And I believe that all of us as health leaders have had this responsibility to recognize that, embrace it, acknowledge it, and respond to it. And I think that has been transformative for the industry.
Before I let you go, during COVID, the worst times, you remember people were celebrating our heroes in healthcare, nurses, physicians, other folks in the hospital community who were just putting their lives on the line every day, extraordinary heroes. How did we lose that?
I think that we will always recognize the people who deliver healthcare to their communities. We will always.
They're still heroes. Whether
They
people
are
acknowledge
still-
it, they're still heroes. I'm sorry, Deb, go ahead.
They are still heroes, and we may not be standing outside banging on pots and pans and cheering them on, but the communities that we serve and the communities that need us recognize the heroic impact that the professionals have.
Again, for those who act like when that happened in March of 2020 and those many months and years after, that somehow those healthcare heroes are not heroes, you're sadly mistaken. And when we go into a hospital, you know what those folks do for us and our family members. And so they'll always be heroes. And to Deb Visconi and your team at Newbridge, I want to say thank you for your work. Deb Visconi is president and CEO of Bergen Newbridge Medical Center. Deb, thank you so much for joining us. We appreciate it.
Thank you, Steve.
You guys stay with us. We'll be right back.
One-on-One with Steve Adubato is a production of the Caucus Educational Corporation, celebrating 30 years in public broadcasting. Funding has been provided by the New Jersey Education Association, New Jersey Sharing Network, Delta Dental of New Jersey, PSEG Foundation, the Healthcare Foundation of New Jersey, the Russell Berry Foundation, the Adler Aphasia Center, Community Food Bank of New Jersey, and by the Fidelco Group. Promotional support provided by NJ.com and by CIANJ and Commerce Magazine.
Hey kids, PBS Kids and Delta Dental want you to have a healthy smile. So here are some tips for you to remember. Number 1, eat plenty of crunchy fruits and vegetables. Number 2, brush your teeth after eating sugary snacks or drinking sodas. And number 3, drink lots of water to wash away food particles. When your teeth are happy, all of you is happy. From PBS Kids and Delta Dental, have a healthy smile.